Hi, Mr. T. Thank you for being here today in support of Miss T as her care partner. Before we get started, I want to ask how you're doing today, as well as Miss T.
We've been doing good, but it's been difficult given the circumstances.
Yeah, I completely understand. What you're both going through is really hard, and I want you to know that I, as well as the rest of the care team, we're here for you every step of the way in Miss T's recovery. Today, I'm going to walk you through the results of her swallowing evaluation, explain what they mean, and show you what our therapy plan will kind of look like. I'll also teach you two techniques that we'll be using so you feel confident supporting her at home. Does that sound good?
Yeah, sounds great.
Okay. So Miss T's swallowing was evaluated using a moving X-ray called the modified barium swallow study. This allows us to see how much food and liquid move through her mouth and her throat and how they move. If you look at this image right here, this is an animated visual of the mouth and the throat. So what we saw was that the muscles in the back over here, they weren't working as strongly or as quickly as they're supposed to. This is very common after a neurological event. For thin liquids like water, the swallow sometimes started a bit late. When that happens, liquid could get too close to the airway, and in a few instances, some liquid ended up slipping into the airway. So, comparing the image on the left to the right, you can see that in the left image, the bolus, which in this case is the food, it's moving together in one piece and going down into the esophagus the way it should. The epiglottis, which is the flap here, has folded down to cover the airway so nothing enters into the trachea. In the image on the right, you can see that the same flap is still upright. This happens when the swallow hasn't triggered yet. The food reached the throat before the swallow response happened, so the epiglottis hasn't had a chance to fold down. When the swallow is delayed like that, the airway is still open, and that's why material can slip toward or into the airway. Miss T was able to cough when this happened, which is a good protective response, but unfortunately not everything cleared. With thicker liquids and purees, things were a little safer, but we still saw some residue and reduced muscle movement. So over here, there can be residue after a swallow, leftover food or liquid, either in the pharyngeal cavity down here or in the oral cavity over here. So overall, this pattern is consistent with moderate to severe oropharyngeal dysphagia, which means that her throat muscles need strengthening and coordination work to help her swallow more safely. Does that make sense?
Yeah, I think so.
Okay. So now I want to touch on how therapy works and what our goals mean. Swallowing therapy is similar to physical therapy. We're strengthening the muscles involved in swallowing and retraining the timing of the swallow to protect her airway. Over time, this helps prevent food or liquid from going down the wrong way. But our goals are for her to improve the strength and timing of her swallow, reduce how often food or liquid gets near that airway, make eating safer and more comfortable for her, and then finally, also to gradually return her to a less restrictive diet as her swallow does improve with time. Now, everything we do will be slow, steady, and it'll match her progress over time. Do you have any questions so far?
Yeah, can you explain a little more on the less restrictive diet?
Yeah, of course. So when we talk about moving towards a less restrictive diet, we simply mean allowing Miss T to eat and drink a wider variety of textures safely. So right now we're limiting her to purees and mildly thick liquids because those are the easiest for her throat muscles to handle and the safest for protecting her airway. As her swallowing improves with the therapy and over time, we'll gradually reintroduce foods that require more chewing or control. Things like soft solids, minced foods, or eventually even regular textures. The goal is to help her return to eating as normally as possible, but only when it's safe. Does that all make sense?
Yeah, I think so.
Great. Now I want to move on to the techniques that we're recommending. So I'll tell you a little bit about it, why we're going to be using them. Then I'm going to model it and I'll have you do it after me. Does that sound good?
Mhm.
Okay. So the first technique is called the effortful swallow. And this one helps strengthen the muscles in your throat so they squeeze harder and move food down more safely. I like to think of it like lifting a weight at the gym, but for your swallowing muscles. So here's how I do it. Watch as I swallow with more effort. Now I want you to try, but first I'd like you to swallow like you normally would.
Okay.
Great. Now this time really squeeze all the muscles in your throat, almost like you're swallowing a big piece of food. You should feel a stronger pull in your throat when you do it. Go
Okay.
ahead.
Yeah.
Yeah. That was perfect. Did you feel that your muscles were tighter that time?
Yeah, I did.
Yeah, good. So we're recommending effortful swallow for Miss T because her throat muscles aren't squeezing quite as strongly as they need to. When the squeeze is weak, a little bit of food or liquid can stay behind in the throat. That leftover material can slide towards the airway after the swallow. This exercise is like strength training for those muscles that push the food down safely. The stronger that squeeze, the safer and more effective your swallow becomes. Do you have any questions about that exercise?
Yeah, how many times a day should she be doing this exercise and should she be doing it with foods and liquids?
That's a great question. So we'll recommend that she does 10 repetitions of that 2 times a day. And it's going to be used as a strengthening exercise, meaning it's not something that she'll need to do while eating or drinking.
Oh, oh, okay, that
That
makes
make
sense.
sense?
Yeah.
Okay, awesome. So the next exercise we'll go over, it's called the swallow, cough, swallow. And this, unlike the effortful swallow, it is a protective strategy that she will use during consumption, anytime after a swallow that she feels uncomfortable. So this one makes sure that we have nothing sitting near the airway after you swallow. It's a pretty simple 3-step sequence. Step one is you swallow. You take a sip or a bite of something and you swallow. Step two, right after you swallow, you give a strong cough. And then step three, you swallow again to clear any of the anything that the cough moved. So I will model the technique with my glass of water, and then I'll have you try it with yours. So first I'm going to take a sip and swallow, and then I'm going to cough, swallow again. And that's it. Now you try. Good. That was great. So when Miss T uses this, you can help by making sure that she sits upright, pauses between each step, and doesn't rush through it. This exercise is important for Miss T to keep her airway protected. On her swallow test, a little bit of liquid came close to the airway before her muscles fully closed. So this strategy gives her throat a chance to clear anything that might have gone in the wrong way. Do you have any questions about the swallow, cough, swallow?
No, not right now.
No?
Thank you.
Okay, great. Do you feel comfortable helping her with these at home?
Yeah, yeah.
Yeah, okay, good. Now that we've gone through the exercises and the safety strategies, let's talk about what you'll be doing at home. Your role and your support makes a big difference in Miss T's progress, so I've put everything into a home program for you. That way, you'll know exactly how often to practice and when to use each technique. So I'll show you that right now. All right, so if you take a look at the home program right here, for homework, I'd like her to do 10 effortful swallows and 10 swallow, cough, swallow sequences twice a day. Over here, you'll see a simple chart to mark when these exercises are done. She should be seated upright, fully alert, and never push through fatigue. If you ever notice more coughing than usual or any discomfort, just stop and you can let me know. My contact information will be right on the last page right here.
Okay. It's easy.
Okay. Thank you, Mr. T, for doing a great job supporting her. I know this was a lot of information and you definitely don't have to have it all memorized. Do you have any questions or anything you'd like me to go over while we're here right now?
Not right now, but I'll let you know if anything comes up.
Okay,
Sure.
great. So I'm gonna send this home with you. It's the Swallowing Therapy Home Program. So it has the exercises to practice at home on here that we just went over, but it also has some additional information,
Okay.
including Miss T swallowing, changes a little bit about that. And then it also has listed her current dietary recommendations as well as what to avoid too. And then it also has safety tips for eating and drinking and her tracking chart that we went over. And then there's also when to stop exercises and call the therapist, as well as my contact information right under that.
Okay.
So I will send that home with you. And thank you so much for meeting with me today. And I will follow up with you during our next session with Miss T.
Awesome. Thank you so much.